Welcome back to the Neurologic Wellness Podcast. I'm Dr. David Traster, and today I'm with Dr. Cedrick Noel. So thank you for being here.
Thank you for having me. I really appreciate the opportunity, and it's an absolute honor.
Absolutely. And so why don't you start? Give people a little introduction about you and about what you do and how you help people.
Yeah. Well, I'd be happy to do that. My name is Dr. Cedrick Noel, as you now know. I'm a chiropractor. I've been in practice for 23 years or so at this point. And I think the best thing I can say about who I am, what I do, is I am just wired to be so determined to help people and to find answers, especially with those patients that are not getting helped. Most people know me in our field as, of course, I practice functional neurology, and they know me for that and some of the things that I've created. I've created an app called the Focus Builder app and a number of other educational tools to help our profession, the professionals in our field, communicate complex information more simply. And that's ultimately, I think, what I'd like to be recognized for is someone who is creating a bridge to make it easier for doctors to convey their findings, but also make it easier for patients to understand what we're seeing as clinicians, and also for trying to get more and more people involved into functional neurology, because ultimately everything's neurology. And it's just been one of those things that I think people have associated as something too complex, too big to take on. And I think that everyone can learn neurology, and I'm just determined to draw as many people as possible into our field, and that's my ultimate purpose and goal.
Amazing. So why don't we start with one of our first interactions? When I was a student, I needed X-ray credits.
Mm-hmm.
So I actually went to your clinic and you were nice enough to bring me in, and I got some X-ray credits through your clinic. So I was allowed to graduate. So thank you. I
Oh
appreciate
yeah,
that.
yeah,
And
absolutely,
then,
no problem.
but at that time, it was almost like my perception, and you could correct me and you could expand on it. It seemed like you were just starting to dab a little more. You just got your saccadimeter, right? That people were
Mm-hmm.
using to measure saccades and fast eye movements. But you had a pretty strong background on the musculoskeletal system and in chiropractic. So why don't you walk us through kind of your evolution of where you started in your career compared to now, how you ended where you are, and kind of how that process went?
Oh, that's such a great question, and I think I thank you for asking it, because that's critical. So I graduated in 2002, and I think at the time when we met, yes, I was learning neurology. I started in 2006 in neurology because I realized that, well, after 4 years of practice, yeah, very strong on the musculoskeletal side. I love working with my hands, working with the body. But I quickly realized that there's too many people that were not responding as predicted or as I would hope for. And the percentage of failure rate from my perspective was too high, and it was depressing for me in practice. I felt like it was unacceptable, and I just absolutely hated my job because I felt like I was telling people to follow a certain process, when too many were not succeeding, even though they were doing exactly everything I was saying. So something big was missing, obviously. So I got into neurology, started taking some neuro courses in 2006. And what I thought I was getting into was basically an understanding of exactly how everything works in the body, and basically what can we do with the brain to make what's happening structurally better. And it's just not where functional neurology or neuro rehab was at the time, and that's understandable. I mean, there's only so much we truly know and understand about the brain, and that continually evolves over time. And so anyway, so I was on this long journey of trying to understand what functional neurology is, how we can apply it clinically. And for about 10 years, I had no answers. I just kept on studying and tried to apply things and just couldn't really put it together. And I don't remember the exact year that we met, but I was on that journey. And I would say those were some of my least successful years in practice when we met, because I was trying to learn and then apply. And then, that just throws off your whole flow as a clinician. When you learn something new and then you think you're seeing that with one person, and then by the time you realize what you're seeing, it's time to move on to the next person if you want to keep the lights on. And it's just, the whole model was I was struggling with it for a long time. So yeah, I think when we met, it was around that time where I was implementing as much as I could, but I couldn't quite get away from the structural model entirely, because when I loved it, but also because it was also helping some people, and I just didn't have a lot of answers I didn't have. So those were growing pains for many years, and that's about when we met. Is around that time where I was integrating a lot of things. And you were emerging as a upcoming great doctor.
Yeah, appreciate that. So let me ask you this. Let's talk about your practice now, and then we'll back up a little bit, because you have a multidisciplinary practice, it seems. So why don't you talk a little bit about the other people that you work with, both people who might do similar things to you, but people who also do different things?
Yeah. Well, first of all, I've always practiced with other clinicians, because I find that I love the team approach. I think that our learning curve can be so much quicker when we can work with other people. And in the practice that I was in when we first met, I was the only one practicing neurology out of 4 doctors in that small office. Now, in 2022, I opened up, in collaboration, my dream office, and with Dr. Ben Barrett, and my wife, who's an OT. She's an occupational therapist and neuro rehab. And so the 3 of us came together and decided, I think it's time, let's open up our dream clinic, because if we don't do it now, it'll never happen. And it's a pretty large office. So we quickly realized that, we have enough room. Let's add other clinicians. And over time, we've had different people come and go, but the team that we have currently, I absolutely love. So we've got in here a microbiologist, and her specialty is gut restoration. She personally was diagnosed with MS 10 years ago, put herself in full remission for 10 years now, by healing her gut. So she went from optometry school and working as a vision therapist for 9 years to being a gut restoration specialist. And she is an absolute master at it. I've never personally known anyone who understands the microbiome as well as she does. And so she got a master's degree specifically in that area. And it's been really cool, because in the time we work together, we're learning a lot about how brain care and true gut care, because we can all, prescribe, recommend, probiotics and some kind of program to heal the gut, but she is so pinpoint specific, just like we try to be in neurology. We want to be as specific as possible. She does that for the gut, and that combination has been phenomenal. Other than that, we currently have a chiropractor whose specialty is chiropractic biophysics. He's got a foundation in neurology, but he is not a neuro doctor. But he's got enough of a foundation to do basic things, and then and do well with it. And then if he needs to refer out to either Dr. Barrett or myself, we do that internally. But structurally, it's been an amazing process, because this is my ultimate goal. That's been my ultimate goal since the very beginning, is how do we bring neurology and structural care together? And I started with structural care and got out of it because the neuro piece was too critical and missing. After all of those years, after 20 years in practice, so in 2022, we're finally circling back around to understanding how can we bring gut care, spine care, and brain care together to help patients. And we're finally there. And it couldn't be answered by just one person, like just me. It had to be answered by a team approach, but really bringing some of the best in the field in different areas together. And everyone with a true respect and appreciation for neurology, because in the end, we are brain-based being. It's our brain that controls everything. And so we have to respect that, but also work with the whole system together. So I hope that answers the question.
For sure. And
It
so
kind of
let's
went on
just, for a
along.
patient wondering, when they come to see your clinic, are they getting everything? Are they picking one person to work with? How do you go through with that with each patient?
That's a great question too. So in general, people are referred here to one of us. And then if we feel like, okay, based on what you have, you need to see this person and that person first, or this person in conjunction, we make then that recommendation. However, we are working on a model because more and more people are asking, what if we want to do all of it? So, and I do think there needs to be an option for people to come in and have, at the very least, baseline neuro work and some structural work and some gut restoration. So we're working on a model where someone can come in and say, I want the best that this place has to offer. And so what that would look like is an examination that is done in multiple parts. And then we would come up with recommendations, which would be either we're going to apply different services at the same time, or one and then follow through into the other. But in general, what I'm finding is that having a solid, balanced neurological foundation first makes the most sense. There are sometimes, and that's why I'm happy to be a chiropractor, because sometimes, we get a patient to a certain point and a particular subluxation or structural issue has to be corrected in order for them to even go beyond that level. So, the system is not just a one-way system, it's multidimensional, and everything has a say into how we are affected neurologically.
Amazing. So let me ask you this. I think it's a good place to kind of start this journey. Before we get more deeper in neurology, we had a mutual friend and colleague in Jason Whitaker.
Yes.
And so why don't you kind of explain what he did to you professionally?
Yeah.
And how that kind of led before we get into Focus Builder and some of the things you've done and Gravity Routine. Why don't you start there and just kind of, because I met him through Dr. Melillo's child development disorder in 2010, I think, right? So 16 years ago. And that's how I met him. And obviously he was a very smart guy and very detailed and analytical. So why don't you give that a respect for him, a little tribute and an understanding of how he impacted you professionally and personally, and how he's influenced where you are today.
Yeah. So my oldest child, Olivia, she's 14 now. Back then, she was in her first year of life when we first met, when I met Dr. Jason Whitaker. And it was in that course, the Dr. Melillo's course back then. My daughter had a stroke at birth, and I didn't know that she did because it's a mild stroke, but we could tell that as she started getting on her feet and walking, and she had a sighted preference really early in life, too early, that we felt like, my wife and I were like, there's something going on with our daughter. So anyway, so I went in and took that course, really mostly because of her. And that's where I met Jason Whitaker. This guy just impressed me from the first minute because he was new to neurology, yet he had read so many neuro books already before course one. He came in there. He's the one that reads everything, and he comes in, he goes, yeah, Melillo's book. He read the whole thing before the course started. It's a pretty thick book too. And so, he was devouring and consuming data and information. That was just his favorite thing to do. And that is not me at all, So I'm more of the guy that is hands-on clinically. I'm observing patterns, and I'm observing what works, what doesn't work. I learn, but I learned, I'd say a different way. And so we came together because I had started to create the Focus Builder app. And actually, you made a great suggestion right early on, because I made the app specifically for anti-saccades initially. And you'd mentioned, you actually had made some suggestions on, hey, you might want to add this or that, or just make a few modifications. But it was a very basic app. Nothing special in there initially, other than anti-saccades, saccades, and pursuits. And then I was talking to Jason and some other people in the class about creating a poster, because I kept on drawing the brain on a dry erase board, and I'm not great at drawing, and I thought, I'm drawing the same thing every time. Why don't we just make something and then make a dry erase so we can draw our findings so patients can understand what we're doing. So Jason kind of was paying attention to what I was doing. And he was the third person to come to me and say, I like your ideas and I like what you're doing and I'd like to be part of it. And the second he said that, I'm like, Jason, you're in. We shook hands. We're like, let's do this. And the reason why I love that question that you just posed. What drew me to him is his selflessness, his love, and his care for people and our profession. And, we both shared that, and he's very authentic and just loving on our profession. He often would do just about it, whatever it took to help students learn and integrate neurology. And so together we decided, we don't know what we're doing business wise. We didn't have a business. We just had some products that were thrown together at that point. And I felt like I needed him because he brought an aspect of an approach to neurology that I didn't have, that I felt was complementary. I tend to be very creative and I have ideas and I finish everything I start always. I have a high level of motivation and determination, whereas he comes in and he comes from a very different perspective, and it was very complementary. And so then we created our business called Nerd Solutions, and the whole purpose of this business is to make clinicians more successful, and to make the work they do in their patient care more successful. And the reason why we decided to do this is because we felt like if there's something out there that is helping us in our clinics, it's because it's not out there, it's not existing. If we're creating something, it's not to copy something else, it's because it's not there. Or if we teach something, it's because there's too many of our colleagues that are not understanding key concepts that can help them get into practice. And we don't want people to drop off. We don't want to lose any neuromates that are like, this is too much for us. So whenever we do something, it's to help our profession and to grow our numbers. And that was really our goal to collectively. It was like, let's help our profession. And that's why we did that together. So I love Jason. And sadly, Jason has passed away this year. He had an acoustic neuroma. And that was in 2019 that he first discovered he had that. And I believe it was 2019, 2018 or 19. He had it removed twice. And the second time he said, guys, I just can't do this anymore. I'm going to just let it be. And I'm just going to let it take me whenever that time is. And so, and it was in May of this year that he passed away. But even up until near the end, he was determined he wanted to make it to our last course together, which was really 2 years ago. And he didn't make it, but he wanted to be there just so that we can go to the MRI center, MRI his brain, bring him in and just show people this is what it's like. And he wanted to be assessed, tested. He wanted people to learn from his condition. And he was not in a good state, not enough to travel. So it didn't happen, but that was his intent. And that just shows who he is and the type of person that he's always been.
Yeah. Sometimes I wonder who spoke more in those seminars, his questions or Dr. Malolo teaching.
Yeah.
But
For
so
sure.
why don't we start with Focus Builder? Because obviously I appreciate that. I did give some suggestions. Even during my vestibular program, I mentioned suggestions because, again, I'm here to help people too, right? And I don't need interest or money. My goal is to help people, and the better Focus Builder does, the better I can do. And I originally used to tell people I don't use Focus Builder a lot unless I have to, because I don't want to give people so many options. But to be fair, you guys made it so good, I use it a lot, right? Because you guys kept
awesome.
updating it, and you guys kept adding more to it where there's things I can't use outside of Focus Builder. And it's very easy to use as a patient. So a lot of my patients use it. So why don't you discuss what is Focus Builder that people might not know? What is it used for? Why do people use it? And how can it benefit people if they go and download Focus Builder at home?
Well, yeah, that's a great question. And obviously we have to credit Dr. Carrick for that, because, man, he has just pioneered the way when it comes to eye movement training, eye exercises for the benefit of the brain. And so Focus Builder is an app that is designed to prescribe or create eye movement strategies to specifically activate regions of the brain. You can use those strategies to activate the brain, or you can use it to promote healing within the brain, or even to improve eye movement control, and vice versa. There's just a lot of purposes, but it's loaded with a ton of, you're right, a ton of exercise. It's overwhelming when you open that app. It's like, oh my goodness, there's so much in there. And that is to the fault of Dr. Carrick, because and especially when around the time when we met, Dr. Milello was the first one that I learned from in terms of using anti-saccades. And when we're doing anti-saccades in his course, I was creating videos of myself, like going like this, and I had to make so many different ones because patients would pick up on the patterns, and then decide to make the app. And then Dr. Matt Antonucci said, if you're going to do anti-saccades, why don't you throw in pursuits and saccades? And like, yeah, it's a great idea. So I did. And then when we came out with the anti-saccades, you made some suggestions. You said, hey, you should consider a go, no-go feature, I believe, is one of the things you mentioned. And then adding different targets, or all the way down to one, so that the fixation dot disappears. I think those were some of your suggestions. I lose track a little bit sometimes, because honestly,
okay.
More than half of what's in there is stuff that people recommend. They're not all my ideas. That's our profession reaching out and be like, hey, I want this. Can you put it in there? And the challenge is that we do get to a point where the app is just loaded with so many options. And we've completely rebuilt it, actually. It's rebuilt and it's in the App Store right now, but not live, but it's been approved and it's in the store as we speak. I got word yesterday that a completely new version is in there.
Cool.
And so it will not be an update from this current version. It'll be a completely separate app, because this one will eventually be completely removed. The new one has a professional side and a patient side. So basically, we've answered the demand of being able to create an exercise and send it to a patient. And to be able to do that, and even to lock out, you could just have that patient only do what you sent them.
Amazing.
So that'll be there. And our goal is, we want to make things affordable. Life is crazy expensive now, and it seems like the amount of devices and things that are available to patients and to doctors, everything requires a subscription. It's just overwhelming. I mean, it's just crazy. It used to be so simple, and now it's so complicated.
Yeah.
And so expensive. So part of the reason why a lot of things are shifting towards a subscription base is because of cloud. Anytime you have anything in the cloud and that requires a cloud database, there's a cost with that. So anyway, so we're going to roll that out this month. So just so you know, there's going to be still a version that's available that anyone can purchase for a one-time fee for life. You've got it, and we're going to make it crazy cheap in the first month. It'll be and it's always going to be affordable, but it's going to be super affordable when we first roll it out, because we know there's going to be some issues with it. We're going to have to work through some bugs. On the doctor side, there would probably be like a yearly fee, but again, super affordable. Like, we've only charged like one time for anyone who buys the app ever. It used to be like $15. Now it's like $69. When this new one comes out, it'll be even cheaper than that at first, so that people can get comfortable with the change. But that's going to come out, and then it's ready for Android. So as soon as we have it working on Apple, we'll roll it into Android right away. So
amazing.
But anyway, that's coming. So
amazing.
Sorry, that was a long answer again.
No, it's good. But I've always appreciated your ingenuity, right? Because you seem to be almost like an engineer, inventor type brain, in my perspective. Mm-hmm. So you're able to take ideas and create things out of nothing. And so why don't we jump it a little different before I get back to neurology? It seems like you created some type of at-home decompression device. And so why don't you get into that a little bit, and about how patients with back pain or different musculoskeletal conditions, what have you developed, what have you invented, and how does it help people?
So I want people to have autonomy. And I remember hearing Dr. Carrick using that term before. our goal is for people to get their life back. And as clinicians, if we can give people a chance to be more active in resolving their problem, I think it's a great way to go about it. And so back in 2013 and 2014 is when I 2014 is when I got a patent on part of this device. But I've had chronic low back pain since my late teens. And what I didn't know back then, because I play ice hockey, is that my back pain was really a manifestation of multiple concussions. But I didn't know that early on. So my lower back issues evolved and progressively got worse and turned into disc herniations and chronic low back pain constantly. And so I made a home device. It's called an inversion belt. And at first I was just inverting on an inversion table with this belt. And it gave me amazing relief. I mean, it really allowed me to function well and to keep staying active for a long time. But inversion comes with its complications. So I really wanted to come up with a horizontal system. And that's it just came out in this summer. Like in May, we came out with our bench. It goes with the belt. And we teamed up with the Resimax. So they have a Resimax Mini that looks like a hockey puck, and that can be inserted in the bench, and so you can have vibration right through the sacrum while you're decompressing. And so again, it's one of those things that I did because I felt like I needed it. And then I have a lot of patients who need spinal decompression, but they can't commit to what is required in terms of in-office visits. And so it's great to have a tool that they can use at home so they can decompress much more often. And I found that my success rate with patients with disc issues and low back pain, patient care improved significantly when they were able to take their home device home to continue their care at home. And it doesn't replace what we do as clinicians. It's a complement to it. It's an extension of our care into their home. And so that's what we did. So we created that. And honestly, I love creating things. I like making things out of nothing, or have an idea and let's put these together and collaborate. This was a big one. It was a really big one, because when you make something that's big, and you have to make thousands of it, it takes a lot of space, and it's a huge risk. It's not something I honestly didn't need that in my life, but I did it because it helped me so much, and it's helped so many people that I love and care for so much, and that's why I did it. And so that's the in-home spine care.
Why don't you explain a little bit about the difference between, some people might go to a chiropractor or PT and you see these huge decompression tables that could be costly. A lot of times there might be an insurance clinic, but you got to pay out of pocket cash to get the services. So what makes your device at home different than devices you might see in a clinic?
So, and honestly, we have 3 of those in our office. So they're necessary. It doesn't replace them. The difference is that when someone's in acute care, they need to be in the care of a doctor, because to get out of that acute phase, you need those devices. You need a lot of other things around decompression. I don't believe decompression by itself is ever the solution to people's problems. Like for me, I had concussions, and it's not until I figured out that vestibular integration was the key to changing postural tone and all these imbalances that I had. I actually, my involvement in vestibular care, and I know you're huge in that area, was all based on my own personal results. I did what helped me, and then I did what helped me first, and then what helped patients. And if I could see a trend of success with what I was doing, then I would adopt it, and I would keep working with it. But the problem is that I think that, of course, some people that are in acute situations, they need to be under the care of a clinician. But the problem is you eventually get to a point where you're out of that phase, and there's tremendous benefit in decompressing the spine for well beyond pain relief. And that was my story. I realized that I committed to decompressing my back at home at night before I go to bed, which you can only do that at home because your discs, do compress. You lose hydration every day throughout the day. Up to 25% of hydration is lost throughout a day. And you recoup that when you sleep at night. So if you decompress before you go to bed, I find there's a tremendous benefit. But the point I want to make is that what if you're out of pain and most patients, they're out of pain. They don't want to keep going to the doctor's office. But what if you continue for 3 months or for 12 months to decompress your back, and then you just maintain it, for a lifetime on a much lighter schedule? And that's what I did for me. And I've been out of back pain for so many years, which is crazy to me because I'm 46 now, and I had back pain, chronic back pain in my late teens. I was 19, 20, and chronic low back pain. And I had it all the way until my 40s. And so how is it that now at 46, I could say I have less back pain now than I had it in my 20s and in my 30s?
And as a practicing chiropractor also.
Absolutely, as a practicing chiropractor, because chiropractic alone was not helping me. Decompression frequent decompression at home is what I needed, but even that by itself didn't completely resolve the issue until I added the neurological component. And it's not that I didn't want to add it earlier. I just didn't know what to do, and so honestly, I think collectively as a professional field, a lot of what we do every day, even the things that I create are not like entirely created from the ground up. You take things you learn from other people, you take things that exist, you put it together, you tweak them, and that's how we go along and create new things and make things better. So
let's talk about that, because obviously, like you said, a lot of our world, and to be fair, since the whole Sidney Crosby episode in early 2010s, a lot of the concussion world and a lot of the neuro rehab world does stem from Dr. Carrick, right? And so there's always a root to that.
Yeah.
But having said that, and that's obviously I have respect for him, you obviously work with Dr. Ben Barrett.
Yeah.
And you've worked with other people who we've all learned from Carrick. And then what you do well, which is something I don't do as well, is you seem to be able to simplify things and protocol things for people, where I'm much better at every patient's unique and different. And I can almost give people an a la carte menu of 1,000 things to do. But it does take a little bit of nuance, intellect, IQ, observation skills to really be able to match it individually every time. And what you seem to have done well is to take some of those concepts and say, hey, what about the 80%? Can we simplify things and really hit the 80%? So why don't you talk a little bit about, Dr. Ben Barron that you work with now, and kind of how you kind of got about Gravity Reset, what that meant for you and how it's developed over time.
Sure. Yeah. So basically, I thank you for acknowledging Dr. Carrick, because goodness, if he hadn't done what he did, none of us would be doing what we're doing. And, who knows where we would be, but what an incredible man and incredible contribution he's made, not only to all of us professionally, but I mean, hundreds and thousands of people around the world have benefited from and indirectly from the work that he's done. He's been teaching. So yes, phenomenal. And so, back to all of that. So Dr. Ben Barrett and I started practicing together in 2022. And, he worked and learned a lot from you, as I've taken one-year courses in the past, and I felt like, wow, I love your style and the way you teach. And I think that's why a lot of people are attracted to what you're doing, is because you can teach it in a way that you can learn and apply. And that, I think, is my objective in life, is to try to make it easier to learn complex things, not just for patients, but for doctors. I think our messaging is important. And that allows for newer doctors to have a starting point, and then to take it deeper and take more advanced courses. And so that is my goal. But when it comes to Gravity Reset, so what happened is, in 2010 was my first vestibular course, and Dr. Brock was teaching, basically he was encouraging everybody in the class, is like, do as many of these maneuvers, Epley maneuvers as possible, like do them all the time. And so I'm like, yeah, I'll do that. I can do that. So I started doing that with all of my patients, just to practice. And patients are like, why are you doing that? I'm like, oh, it's, it's good for you. And I was observing. And what I noticed is that when I did canal maneuvers, and this is just me and my practice, patients loved it. It felt good. I liked it. I like doing it to myself. I felt like it was starting to change my tone, my muscle tone, in a way that I had this chronic left-sided muscle tension, posterior chain was always tight. Nothing could change it. And that's completely gone now, but it wasn't for the longest time. And when I do those maneuvers, it just felt good. But what I noticed clinically is that when I would check balance is that by itself in my clinic wasn't enough to change balance until patients would walk. And then we would check their balance and then it would be better, but they would have to walk for it to be better. And so that all changed when Dr. Barron and I, even before we got together, I was doing some walking. I started dabbling into walking in different directions, different planes, but I wasn't doing a lot of it. I just wasn't sure what it was about it that made a difference. Is it the walking? Is it the motor component? But then I saw Dr. Barron in our clinic when we opened our office. I saw him translating people in chairs sideways, to the right or to the left or at a diagonal plane. I'm like, ooh, I really like what he's doing. And I kind of combined some of what I was doing with weighted headbands and laser feedback glasses in these canal maneuvers. And then I started adding in a translation after doing those maneuvers. And I noticed that every time balance was better, almost every time, like a high 90 percentile of change, we can improve balance whenever we do a translational movement while keeping our laser or head lined up with our target, eye, head, and target together in plane. And so then at that point I realized, and we didn't even talk about it, I just saw him do it and I just started playing with it. And I realized that that's the missing piece. It's the translational movement. The otolithic stimulation is the key. And so once I started working with that over the following years, anytime I would not succeed with a case, no matter what it was, truly, no matter what it is, I'm like, let me see if I can translate this person in different ways. And I always reverted back to let's translate the patient. And now what we do is we completely change the whole thing. I mean, when we do a canal maneuver, we are translating off vertical at different points within the maneuver. And it's really more, and then we're also translating the table. We're using every possible plane you can imagine off vertical and upright in a chair or upstairs or stepping. We're using all of those different planes. What I've come to realize is that if that is the only thing I do, and that's truly how I do things, I learn something and I use it through and through in every possible way. And I've come to realize if I just leverage the gravity receptors for everything, what kind of success can I get? And then if I don't get as much success as I was hoping for, then I layer in something else and something else. But that's where I start. And I've been doing that now for years. And I realized this is crazy good, the change we can make. And that this is truly foundational. And so that's where Gravity Reset came about, because it's leveraging the otolithic receptors in as many ways as you can creatively think of using them. In the amount of different ways you can use, position the head, position the eyes, move the body. I mean, it's infinite. You can do all sorts of things. But what I started seeing is that people who had tropias and all those things were changing super fast and they were holding. I've had some people who I worked with like 2 or 3 times 2 years ago and then retested a year later and retested a year later. And they're better like 2 years later than they were right after the 3rd visit 2 years ago. So it's crazy. So I feel like the reason why Gravity Reset has taken off like that is because it yields a change immediately and predictably at a really high rate of success, not just in my office, but through and through in other offices. And the foundation of it is easy to learn and to apply. You can certainly step it up at a much more complex level and then layer in everything we learn in functional neurology. And ultimately, the cerebellum, I think I've heard you say that maybe on a post or something somewhere. The cerebellum, my goodness, is golden in terms of what can we do to change the brain through the cerebellum? Well, it's the same thing with gravity reset. We do some kind of foundational gravitational technique, and then you want to build up the cerebellum within that approach, and that really is what creates a lot of change. So anyway, so again, it's one of those things that we're still playing around with, and everyone's using it, tweaking it in different ways. I believe at some point that it will be a foundational neuro teaching. I think it has to be, because it's too huge to ignore. And like anything, when I teach something, I teach it because I feel like it can help the profession, and I feel like I know something that is not being taught in that way. But my goal is for more people to take neuro courses, to become diplomats, and to, if I can be a bridge so that people can at least have a step into functional neurology, and then from there go on and take courses through the Carrick Institute and get certification and go from there. And honestly, I've had so many people come back to me and say, thank you for your course. It allowed me to not give up on neurology and then go far deeper into more advanced courses, which we don't teach. That's not what we're here to do. So
if I'm a patient, why don't you give a little feedback of, because while it sounds great, and obviously I agree with you, right? I do it every day also. I don't do gravity reset per se. And like I told you, maybe I should, but I do similar things, right? And we always start with foundational gravity, gravitational perception. It's the most foundational sensation. It's what builds, it's the oldest sensation, back in the 100 million years ago with old jellyfish type creatures, right? And so before eyes, before spines. And so I am on your page, but if I'm a patient, what does that look like? Like, are you translating people everywhere? Are you assessing people? Are you balancing? Like if I'm a new patient and I come see you, what do I expect from Dr. Cedrick Noel?
Oh, yeah. My goal for every human is, I want to know if I can give this person something to do at home, is exactly in which direction are they going to be translating. That's always my first exercise. It's so safe. I've probably had 2 people in my whole career not respond well to translation exercise. And honestly, it was early in the process. It's at a time where, honestly, I just didn't know as much as I know now. I think I would have done a lot better with them today, but it's so safe. If we do it slow and we do it carefully, it's safe. So my goal for all of my patients is, in which plane am I going to have this person translate? At the very basic level, of course, it gets more advanced and complex than that. But I do a full neuro exam. And when I look at my findings, I want to be able for them to translate in a way that integrates the somatosensory system, the visual system, the cerebellum, in a way that is as corrective as possible in one simple translation. Meaning, are we going to use the right hand or the left hand to map that side, or to integrate a complex movement? If we were to step in one pattern, do we want to have the head this way, the eyes here or here, laser? So we want to know how we're positioning all those parts to make a change with that person. And what I do in my first visit is I do my full exam. It takes me an hour and a half to do. But I try to pull together as many of those things that I can correct within the translational movement as possible. And what I'm finding is that when we do that, I can see a change in that patient immediately after the therapy, 9 out of 10 times. And it's probably higher than 9 out of 10. But it's cool because that tension that I talked about earlier that I had chronically for decades, when I do these maneuvers, it just melts it away. And so I had so much muscle work done, so many adjustments done that were, these patterns that keep coming back in the spine, they go away. This light sensitivity that we have from concussions, that goes away. Like things just, when we start from that foundation, we don't have to treat all the findings we get. We set the foundation right. And then whatever is not better, we can then specialize and clean those things up. And that's how I approach it. Even patients who are seeing me, I have patients who've seen me for 23 years for spine care. They're like coming in weekly for maintenance care. They love it. They feel good as long as they come in and get adjusted. My thought is, I've got 15 minutes with this person. I want to do something neurologically for them. What is the best thing I can do for them? And that's going to be translating, like which direction are they going to translate? And then I'll tell them, when you brush your teeth at home, do your side step to the left or back left at this while you're doing that. They integrate it into your life. And there's more complex cases that it's not that simple, obviously. But my goal is always, what am I going to do from a gravitational standpoint first? And then I clean up the rest. And that process has been massively impactful for so many people. And so when I go to a conference, whether it be chiropractic or optometry, most of the time I'm out in the hallway testing and treating people. And even with hardly anything on me, we can create change predictably at a high success rate with people. So, yeah.
Amazing. Yeah, because I find the same thing. So I find it interesting. Everyone sometimes starts in a similar path, but branches out differently. And
Yeah.
so,
Yeah.
and so it's interesting to see kind of your trajectory and kind of how you developed your technique versus other people versus me. And it's, we're more similar. I always tell people we're more similar than different, because
Yeah.
sometimes people can focus on the differences, not the similarities, right?
Yeah.
But what's interesting is gravity is the one sensation that affects every cell in your body, right?
Yeah.
So you see it from astronauts and you see it from all these different anti-gravity research. And so the impact is pretty fundamental. And like I've said, I've seen the same thing. Back in the day, we used to teach right brain versus left brain, which wasn't so true, but it was the model that we used for decades. And I remember thinking to myself, if it was more than that, people would call it metabolic or vascular, or say you've got inflammation. And I would do these gravity resets or these gravity maneuvers and be like, that all went away. Right? So everything, how could it be inflammatory or how could it be vascular?
Yeah.
10 seconds later or a minute later, all of a sudden all the findings disappear. So the gravity receptors go bilateral. They integrate in so many areas. It made a lot of sense to start there. And I think you found similar things in different ways that what I found, which is just kind of the human nature or consciousness or however you want to call it, right?
Yeah. And on that topic, you're right. It's not, I discovered this myself in my office, but there are people like you and like Dr. John Hatch and Trevor Berry and many others that I don't know of, that were probably doing very similar things either before or at the same time, or maybe they're figuring it out now and they haven't taken any of those courses. And so that happens. And honestly, this earthly life is so short. While we're here, my goal is to help people live the best life they can live while they're here. Hopefully transition to a better place. That's what I live for. That's what I'm made for. We don't get to bring anything we do here anywhere after this life. So I named my process Gravity Reset. There's other people who may do similar things who don't name it that. So it doesn't mean that, hey, if you don't do Gravity Reset, that means you can't help me or you can't address these kinds of issues. You said it well. You might have been doing all of this a long time, and you call it differently. Honestly, naming it has been a game changer, and it was not even my idea. As one of my patients said, you've got to name this, and so like he was relentless about it. Like, okay, I'll name it. So I named it, but honestly, I think it's helped our population and professionally to name it because we can identify with the basic principle, but it's not a hard technique. It's an idea. It's a method that is forever moldable and changeable. And you just add your creativity. Like so many optometrists are doing Gravity Reset now. Lots of them. Half of our courses are optometry doctors, and they're blending different ways. They use prisms with translational work and so on. So it's an idea, and it's giving people a chance to identify with what is this, and kind of have a common ground, if you will. And I think it's been a really good thing for the profession.
It's important too, because I talked a lot about optometrists, developmental optometrists, physical therapists, chiropractors, and the ones that understand what's going on, we all say the same thing, is everyone's so stuck in their box and everyone's
Yeah.
stuck in their lane. And optometry is one of them where it's so vision based. The
Hmm.
idea of even a vestibular therapy is so foreign and
Yeah.
it's so atypical that a lot of people just won't even accept it until
Hmm.
they see the results, and then maybe they will. But the future is going to be multimodal care. But the
Yeah.
medical model is the opposite. It's stay in your lane. Right now, I would
Yeah.
say you're not in your lane. You're a chiropractor. You have no business developing vision therapy. You have no business developing vestibular therapy. You should just be adjusting because that's the lane you should be in. And it's the wrong model because these things integrate. And if you don't understand the integration, you're going to be limited on your outcomes, like you said, or you might help people, but they have to keep coming back over and over again to keep getting the same therapies. That's almost like a band-aid versus looking at the central integration of all these sensations and figuring out how you can use a vestibular therapy to change vision, or how you can use a prism to change vestibular activation, and how these things kind of go hand in hand, which is
Mm.
going to continue to be the future. But even I have friends who are optometrists and they work with pro teams and they can help people hire. The pro teams don't nothing to do with it. They don't get it. Right. They said, no, you do your optometry. I don't want you translating. Or I don't want you
Hmm.
doing this, and it's a model that will be broken eventually, whether it's because you're teaching other people's teachings, eventually it's going to break because it works too well, right?
Absolutely. And you just hit it right on. The integration is the key. And the only reason why anything that I'm doing works as well as it does is because of, it's not like we do, let's translate and then let's do an eye strategy and let's do, like, when you blend them together, if possible for a patient, that's when that integration changes permanently. You want to layer in with your translational work some kind of somatosensory and vision aspect so that it can really fuse together. And that's the key. When we do one and then the other and then the other, which I did for so many years, it's just very frustrating because the results are not that great.
For
So,
sure. And so let's finish off with questions I usually ask everyone at the end. So why don't you tell us your favorite book and your favorite movie?
oh, well, I'll start with the movie. I love Mel Gibson.
Okay.
Passion of the Christ would have to be up there. I love even some of his other movies that he made, like the Patriot, and like this guy who comes out who's got like him and his family, and he's like can take down an army kind of thing. I feel like I relate to that level of drive and motivation. Like, tell me that I can do something, and I'll show you how I can do it better. And that's been my life story. I mean, I had 2 open heart surgeries, and I was told I could never play hockey, and I've actually played an official pro game, and I played college full contact on blood thinners with a metal valve. I mean, no wonder I have all these concussions, right? So all the things you can't do, I love that. Oh, my favorite book, of course, has to be the Bible. If I were to name another one, my good friend Jason Whitaker wrote a book to be published after his passing,
Okay.
and it is, that book is his journey to Christ because he was not a believer. And it was really incredible what happened in the past few years of his life. He just started consuming information, but I mean, he always consumed a lot of information from a neuro standpoint, but he shifted that to just studying religion. And he landed on Christianity and just devoured the Bible, and he would spend 4 to 8 hours a day just studying, investigating, and dissecting. And then anyway, so then he wrote his own book. He said, this is to be published after I pass. It's never to be sold. I got a copy, and it's incredible. It's this whole journey, and he just doesn't hold back at all. But yeah.
That's pretty incredible. Is it ever going to be out for public consumption, or what's the
Well,
concept?
it needs to be. So I'm working on that. I'd like to offer it, because it should not be sold. So we need to just produce it and hand it out. He had 500 copies made, and they're all gone. So yeah, a lot of people have asked me that question. So honestly, it's not a well-written book. It's phenomenal. I love it because it's him. It's his mind. It's all of it,
Yeah.
not holding back in any way at all.
That's a scary thought that it's his mind in a nice way.
It is. Yeah, it's incredible. So I love it, but there's no page number. There's probably like 500 pages. It's not numbered. It's all black and white, little print. And honestly, I'm at the point where I need to get glasses now, and I'm reading his book. I'm like, oh, okay, now I know. I got to go to the optometrist.
Like
I
the
never
D.D.
worn
Palmer,
glasses.
it's like the D.D. Palmer Green Book.
Yeah, yeah, exactly.
Okay. So next question, if you weren't in healthcare and you weren't a doctor, what do you think you'd be doing?
I'd be a preacher.
Okay, that's fair.
Yeah. And I've been blessed with the opportunity to do so a few times. And I mean, I honestly, I love teaching. I'm passionate about it, but I love that. I love bringing both spiritual and neurological together.
Mm.
So I think that's probably what I would do.
Perfect. And last thing, and I think I know the answer now. If you could have dinner with anyone dead or alive, who would it be?
Oh, yeah. Well,
I'll give you two
honestly,
people. I
at
think I
this
know the
point,
obvious answer, so I'll give you two.
Oh, yeah. I mean, I one of the disciples would be great. I mean, Jesus, I see him as still alive for sure, but so I'll just leave him out. I'd love to have dinner with Jason again.
Okay.
Because not long after his passing, I had a dream of him and radiating in light. And he was so happy, peaceful. And he walks up to me, tall, big, strong, muscular, like the perfect version of him. And he walks up to me and gives me a huge hug. And he walks away, gives me this smile, and because of his tumor, his smile got affected naturally. He had this big smile and he looks at me and just walks out. And I feel like, wow, this was right before his dedication of life. And it was him coming to me saying, keep up the good work. I'm in a good place. And I felt like his way of saying, I got here. And, he wrote his book because he wants people to know how he got where he is now. I'd love to have a conversation with him again. I miss him so dearly. It would have to be him.
Out of respect to that, what I would say is if people do have, it's hard to know at first, but if people do have a one-side hearing loss or have a history of a hearing problem, especially if you start seeing a little facial asymmetry and weakness, but even before that, a lot of times it can be blown off with a hearing aid, right? And I think too many times that when you do have a hearing problem, it's something to investigate, because I've had a number of patients with acoustic neuroma. I still have them, right? And it's been missed. And even if you catch it, you might just let it sit on it, but you want to monitor it. And it's just one of those things where I think it's easy to blow off hearing loss as age or as just, an ear problem or a middle ear problem. But the fact of the matter is there are people with these tumors, and because they're slow growing, they don't make you spin. You might not be dizzy. You might not be off balance. You might just have a little hearing loss you might not be aware of. Right?
Yeah.
So you get tested. So I think one of those things out of respect to him is hearing testing is important. And if you do have a one-side hearing loss, you should maybe investigate further causes, because it might be something a little more serious than you think.
Yeah, and I'm glad you mentioned that, because it seems like lately I've seen a whole lot more cases like that, not just in clinic, but even in church and other circles of friends and family. Seems like there's been more cases of acoustic neuromas in my circles. Yeah.
Yeah, it's in general, it seems like society's getting a little sicker. And obviously those acoustic neuromas or vestibular schwannomas, those are real, right? And they're subtle. They're slow growing, and because they're slow growing, you just might not appreciate it until it's too late, right? And then that's a problem, right? And obviously sometimes there's only so much you can do, right? So sometimes it kind of is what it is, but understanding and identifying and diagnosing things correctly is step one, right? And a lot of people miss that. And so I wanted to thank you for your time and your effort and everything you've been doing. I appreciate you taking the time today, and thank you again.
Thank you.